Measuring blood pressure may seem like a very simple and routine procedure. At first glance, everything looks easy. You put on the cuff, press a button, and see the numbers on the screen. But in reality, this is exactly where most people make serious mistakes. As a result, the readings can be inaccurate, which may lead to wrong conclusions. A person might be mistakenly diagnosed with hypertension, become anxious about high numbers, or even start taking medications that are not actually needed. That is why it is important not just to measure blood pressure occasionally, but to do it correctly. Today, we will go through the most common and dangerous mistakes people make and explain how to measure your blood pressure in a way you can truly trust.
Modern cardiology guidelines from different countries all agree on one key point. Home blood pressure measurements are often more informative than those taken in a doctor's office. This is because it is not always possible to follow all the proper steps during a short medical appointment. Patients may be rushed, stressed, or physically active just before the measurement. These factors can affect the result. That is why readings taken at home in a calm and familiar environment are often more reliable and help doctors make better decisions. The first common mistake is relying on a single measurement. One reading is never enough to understand your true blood pressure. The first measurement is often higher than it should be. This happens because your body and blood vessels are still adjusting to the cuff, or the cuff may not be positioned perfectly at first. The correct approach is to take several measurements in a row with short pauses in between. The first result should be ignored, and the average of the following readings should be used. This method gives a much more accurate picture.
The second mistake is lack of preparation. Many people measure their blood pressure immediately after walking, talking, eating, drinking coffee, smoking, or feeling stressed. In such cases, the reading reflects the body's reaction to activity or stimulation, not the true resting pressure. Before measuring, you should sit calmly, relax, and avoid distractions. It is also important to avoid caffeine, nicotine, and food beforehand. These simple steps help reveal your actual blood pressure at rest. The third mistake is incorrect body position. Some people measure their blood pressure while lying in bed, sitting without support, or in an uncomfortable posture. This can distort the result. The correct position is sitting with your back supported, feet flat on the floor, and legs uncrossed. Your arms should rest on a surface at heart level. This is essential for accuracy. If you use a wrist monitor, your wrist must also be at heart level. The fourth mistake is measuring over clothing. Placing the cuff over sleeves, especially thick fabric, can lead to falsely high readings. Blood pressure should always be measured on a bare arm, so the cuff can fit properly and provide accurate results. The fifth mistake is using a faulty device or the wrong cuff size. Even if you follow all the rules, an old or inaccurate monitor can give incorrect readings. Devices wear out over time and should be checked or replaced when necessary. The cuff size is also very important. If it is too small, the reading may be higher than it actually is. If too large, the result may also be inaccurate. The cuff must match the size of your arm. It is also important to put the cuff on correctly. It should be placed slightly above the elbow, fit snugly but not too tight, and allow about one finger to fit underneath. The artery marker on the cuff should align with the artery in your arm. These details ensure the device works properly. Another important point is to measure blood pressure on both arms at least once. Normally, the difference between arms should be small. If it is significant, it may indicate a vascular issue that needs medical attention.
The sixth mistake is measuring only when you feel unwell. Many people check their blood pressure only when they have symptoms like headache, dizziness, or stress. However, blood pressure naturally rises during physical activity, emotional stress, or after eating. This is normal and does not always indicate a disease. Doctors are mainly interested in your resting blood pressure, as this is what determines long-term health risks. That is why it is important to measure regularly, not just when you feel bad. The seventh mistake is not keeping records. Relying on memory is unreliable. Doctors need to see patterns over time, not isolated numbers. Keeping a record of your blood pressure, either in a notebook or on your phone, helps track changes and make better medical decisions. It is especially useful before visiting a doctor or after changing treatment, as it shows how your body responds over time. In conclusion, measuring blood pressure correctly is not just a routine action, but an important health skill. If you measure it without preparation, in the wrong position, over clothing, with an inaccurate device, only once, only when you feel unwell, and without recording results, the numbers may not reflect your real condition. But if you follow the correct approach, your readings will be reliable and truly useful for maintaining your health.